Expert opinions, trusted insights.
This is Eye Surgery Today,
an insider's guide to vision correction.
From 4 of the nation's leading eye surgeons.
Blake, sometimes patients have a hard time putting eye drops in their eye. Can you help them with some tips?
Well, I think that eye drops in general is a huge topic after cataract surgery. And I think that, again, some doctors do it differently. It may be that all of your medications, like your antibiotic, your non-steroidal anti-inflammatory, and your steroid are all combined in one. Some other surgeons do dropless cataract surgery where they place it in the eye surgically. Some people, like in my practice, do both, right? So they kind of cover you both ways. There's not one perfect way to do it. But in those cases that you're using 3 different drops, because some people will still go to the pharmacy and get 3 different bottles of medications, and there's nothing wrong with that. It's a little bit more laborious for the patient, but that does happen. And so it's important to kind of figure out, how am I going to stage these? How am I going to instill the drop correctly? So many of my patients, I watch them use eye drops and it's going on their cheek or their forehead, or, they're using the steroid when they think it's the antibiotic and vice versa. And so it's kind of a mess. So I think that you need to chart out what you're going to do. Okay. You need to have a technique for placing it. I typically tell patients, just take, wash your hands first, of course, and then just take, one hand and kind of lower your eyelid. I like to kind of turn my head a little bit like this, and I like to aim right there in the corner pocket of this eye. And once I feel something in there, I like to kind of put my head back straight again, and I like to close my eyes for a few seconds and just let that soak up. Sometimes there's something called punctal occlusion, where you can actually place your finger right here by your nose to kind of keep the drops on longer. Some patients may choose to do that. And then the other thing I would say is that people always ask, well, what order should I do it in? Or, if I put one in, do I have to wait exactly 5 minutes or 10 minutes or whatever it is? I just think it's important to wait a few minutes in between if you can. Don't put them back to back to back. And if you are using lubrication for dry eye and things like that, wait a good 20-30 minutes before you lubricate, only because that can kind of wash out the medications that you just did. But it's okay to take your dry eye artificial tears around the same time. You don't have to stop those after cataract surgery. In fact, it's a good thing to continue those artificial tears.